I'm Troy Thompson. I'm joined by Dr. Eric Smith and also Dr. Taylor. Now, Dr. Taylor is from Georgetown Cancer Center. Of course, we all know Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. And today we want to highlight, because it is Breast Cancer Awareness Month, the correlation between cancer and obesity is a topic that we don't really put together. I want to ask you, Dr. Taylor, what is the correlation?
Sure. So with obesity, there's a higher risk of a lot of different types of cancers.
Really?
There was a study in 2014 in the British Medical Journal that was a study of about 40% of cancers can have a role played in their development due to obesity.
Now, when you hear these type of stats as well, Dr. Eric Smith, and you hear the correlation, this is something that you would see all the time, right?
Yeah.
And what do you do about that to begin with?
Well, you know, we see people who come to us and they've had cancer in the past. Can I have weight loss surgery?
Right.
Well, yes, because we can remove one of those risk factors. These patients are trying to get healthier, but just like they want to get rid of their diabetes and their hypertension, we want them to live longer, and we want to decrease their risk of cancer. Just as if they would have a screening mammogram, reducing their weight can help them decrease that risk of developing cancer.
What type of cancers, Dr. Taylor, is a direct correlation with obesity?
So most commonly, breast cancer risk in ladies is significantly higher for ladies that are markedly overweight. Also, if somebody has an increased risk with diabetes, and that's usually a weight-based kind of assessment. The other cancers, most notably, are GI cancers like stomach, esophagus, colon. There's been some data that increased risk of endometrial cancer is directly linked to obesity.
Well, I'm going to let you both answer this, but Dr. Eric, what type of surgeries are available and how do we lower that risk with obesity and cancer?
Yeah, so the surgeries that I do for weight loss, sleeve gastrectomy, rheumatoid gastric bypass, all the variations of those are just as applicable for a patient trying to lose weight to reduce their diabetes or to decrease their prevention of cancer. There was a number that he and I were talking earlier, that if you have somebody who's obese and they have diabetes, they have a 200% increased risk of cancer development. Well, that's the most common medical problem we see in obese patients, is diabetes. It goes hand in hand. So those two combined are like a double whammy for these patients.
Mm-hmm. What are you saying to people when they come in to see you, Dr. Taylor, that may be concerned about cancer and that are severely overweight?
Sure. So,
do you think about talking to them about having bariatric surgery?
It's discussed.
Right.
The most common thing I talk with people is usually the American Society of Clinical Oncology recommends diet, healthy weight loss, exercise. And for a lot of people that Dr. Smith sees, they have been trying all those things and they need that extra support, but it is something that is definitely a risk factor.
Well, as always, we appreciate both of you. Always great information. Thank you so much. If you want to find out more information, there it all is up on the screen. Georgetown Cancer Center and also Georgetown Bariatrics and Advanced Surgical Services.